Hey friends, Jessica here from Northern California, and if you are new to my channel, I am here documenting my breast cancer journey. I was diagnosed with stage 3B breast cancer in November of 2022. I shortly thereafter, early December, had a radical mastectomy of the left side, and then I started my chemotherapy before Christmas of 2022. Today, my video is highly going to emphasize my experience during chemotherapy. My cousin reached out and sent a message that she has a very close friend who has been diagnosed with cancer and is going to be undergoing chemotherapy and is wanting my recommendations as far as anything that I brought or any tips and tricks while in chemotherapy. Quick disclosure, my kids are out riding their bikes and little mini Harley. I'm sure you can see them up and down here. They're very excited to be in the video today, so I apologize about the background noise. Most of my videos I do when I'm working because it is nice and quiet. But I really want to do this video for my cousin and for any of you who may be starting your journey or possibly even in your journey of chemotherapy. So one of the first things that I learned during the process of, hey, you're going to be going through chemo, was the fact that a chemo port was highly recommended. It is a port that they put on, most times they put on the opposite side of your cancer area. So I had cancer on my left side. My chemo port is on the right side, right here. A chemo port is placed, for me it was placed about 7 days prior to me starting chemo. They make a small incision where the chemo port goes in, which is like right here. They make another incision up towards your jugular. So the chemo port is inserted, it's threaded up and then down up to your heart. The process for me was not fun. They do give you like a light sedation. Unfortunately, I did not respond to the light sedation whatsoever, and I was awake for most of it. So I think that's why I do have some apprehensions as to having my report removed. Plus, it's already been in here for over 2 years. What's the point of getting rid of it? During chemo, there are 3 prongs to this port. I don't know if you can see that well here, but there are 3 prongs, and that's what the nurse will use to see where to enter the needle to give you the chemotherapy or the flush or anything that's associated with the chemo port itself. So with that, I mean, it's pretty kind of thick skin and then a thick area to get through. And so I was recommended to ask for a topical lidocaine cream. And my oncologist easily said, yes, whatever you need, let's get you doing it. So the topical lidocaine cream is, you put like a pretty good sized dollop on there and you put it on the port area right here and then just put some cellophane right over it, wear it for about an hour prior to getting to chemo. Once you get there, they take that off, they wipe everything down, make sure it's very sterile. And then in chemo, they actually do have, here are the kids, I'm so sorry. They do have what's called like dry ice or it's cold spray. And it will make it so they spray it on there until you're either fine or they start seeing crystals. They take it off and then literally put the needle right in. You don't feel a thing. At least for me, I never did feel a thing. There were times that since going for chemo, just having to go in for check-ins or port flushes, that I have forgotten to use my topical lidocaine, and the cold spray worked just fine. Other things that I kept in my chemo bag as like an always every single time I'm in chemo was chapstick, blanket, comfy clothes, comfy shoes. The best type of top to wear was a Henley. For me, my chemo was during wintertime, so it was cold outside. So a Henley is like a shirt like this, but then it would have buttons going kind of up to here. So you could button the area. They could easily access your port, not have to pull clothing out of the way. So a Henley was huge. It was actually recommended to me by my close family friend when she went through chemo a number of years ago. A blanket. Through Kaiser, they did offer warm blankets, but as we know, those blankets are paper thin. So having my own nice cozy blanket was a huge deal. Drinks, we were able to bring in whatever we wanted, and have as many like canteens as we wanted. Some of my chemotherapies lasted up to 2.5 hours. And so having drinks that made me feel comfortable was really good. My favorite thing was like cranberry juice and 7-Up, obviously without the vodka. Darn it. Or what else did I love? Gatorade, something to kind of replenish those electrolytes that you do miss. Snacks were huge. There was a time my mom came with me and we legit went to Walmart and stocked up like on $40 of snacks and just laughed our tails off the whole time I was in chemo and snacked. And it's funny and it hurts my heart because there are people that are in chemo that are very elderly, that are very sickly, and they are just miserable during chemotherapy. For the sessions that I went through, and I went through 4.5 months of chemo, I was lucky to not have a negative experience through the whole process. The last thing that I would highly recommend, and this is, they say for like 40% of patients, is with the flushing of the port. Sometimes you can get a foul taste in your mouth. They don't know exactly why, but they think it could be because of like the vein like that goes up to your jugular, that it could possibly have some nerve ending sensoring to your taste buds. But I kept mints or something just yummy with me to suck on while I was having my port flushed to alleviate that nasty taste. It didn't happen to me, or it happened to me every time, and probably like the third or fourth time I was like, I'm like, this taste is awful. And the nurse was really surprised to hear that I had the taste affecting me, and so did recommend to bring mints. I mean, they had candy galore there, but sometimes just having your favorite tasting sweet treat was the best. One thing through the second part of my chemo, and I'm so sorry that I don't remember the name of it. It's been, chemo brain is huge. And then just your memory trying to protect you from what you've been through, I think is huge too. But during the second part of my chemo, they did recommend ice packs for my hands and for my feet to prevent neuropathy. So I did wear those and they did help pretty well. I do definitely have some neuropathy. But not nearly as bad as it probably could have been. And then some people do wear the cold caps to preserve their hair. I was not one of those people. I embraced everything that cancer brought on with it. So I was bald for over a year. My family enjoyed seeing me bald. My kids, it was scary for them. But what's really cool is my older kid that's out running around somewhere back here. He was in first grade at the time of me undergoing chemo and everything, and his friends, the little girls, remember me being bald and now having this crazy thick luscious hair. They're like, oh my gosh, Logan's mommy, your hair is so beautiful. And here we have a topless kid. So with that, friends, I hope that you are all doing well. If you're in this journey right now, I'm praying for you. If you're someone who is going to be part of this journey as a family friend, just give them love and support. Ask them what snacks you can bring. Ask them whatever they could possibly need to make their journey a little bit easier. Some people get really sick. I was so lucky to be not one of those people. The worst side effect for me was becoming bald and gaining 40 pounds due to the steroids. You're welcome, honey. This is a longer video than most of them, so have a great one. I will see you in my next one. I do have an update as far as plastic surgery goes. I had a consult with my doctor the other day, so I will sure to make a video here in the next couple days of what's got I'm so sorry. The kids are distracting, but I will update you on what the update is with that. All right, friends, take care, and I'll see you soon. Bye.